Sorry, that was my 3-month-old son. Sorry for the distraction. Going back. So her pallor, her coloring is good. She's looking generally okay to me. So I'm going to go further. And, okay, making sure he's not talking now. I'm going to ask her if she has any issues going on that she needs to talk about or any
Nope, everything seems to be good.
Awesome, we like that. So I would palpate her sinuses. Kylie, you gotta be quiet. We're doing homework.
Uncle Ryan.
Kylie, we're doing homework.
No, I need to talk to Ryan for a second.
He's videotaping for class. My teacher's not gonna like this. Okay, Kylie, do you need to go to timeout?
No.
Thank you. Okay. So then I've also palpated her maxilla and also feel, and you can open your jaw and close. Nice and smooth. Her TM joint is great. Did you have any pain when I touched
that
it?
feels good actually.
Oh, good. I would don my gloves when I would go to her scalp. And I don't have gloves, but I would inspect her scalp, see if any lesions, problems, dandruff, I mean just anything I could find. It looks good from here. Her hair feels nice and thick and long. Shows good nutritional status. Okay, and let's see, I would also feel for any lumps or nodules or any kind of pain or tenderness that she has. And after that, we would go down to, let's see, we'll go to the nose. Ask her if you have any septal issues or
Nope.
broken your nose, nosebleeds.
Nope.
Okay, I would have my wonderful pen light. I would look inside, looks great. She doesn't have any septal defect. We'd also, I'd have her cover her nose, the nostril on one side. I would have an actual, something odor-wise, I just realized I didn't have it at the bedside, but I would have something to smell to test her cranial nerve 1. Do you smell that?
Yep.
It looks like it works. Going on, I would also test her eyes. I would look at her eyes to see if they're moist, her sclera is white, everything's intact and moving. Can you look this way, straight in front? I would ask her, you can sit up right now. There would be a dial on the door. I'd ask her to stare there, please. I'd have my wonderful pen light here, make sure accommodation is good. And if you can turn to me, okay, and stare at the dot behind me now.
Okay.
Okay, and then I would have my pen light and I would, make sure her pupils are equal, and they are, and I would make sure they were reactive to light both equally. So I'd take the pen light and I'd go right across and right back, and then right across and right back, and both would hopefully decrease in size and then dilate. So, and then as we're up here already, I'm going to test her hearing, and I'm also going to inspect her ear, make sure color, by the way, her nose and her face, everything's the same color. I don't notice any deformity or any kind of lesion or scrape or bruise. So anyways, going to her ear, have to look for any lesions, inspecting, of course, visually, and then I would have her cover her one ear. Well, cover the other one,
okay,
because they're on the side.
I dropped something.
Oh, good job. And then I would have, sorry, and then I'd have you take your index finger and press right there, yeah, and just keep doing that, and just repeat the words that you hear, okay, and they're going to be a whisper. Flower.
Flower.
Horse.
Horse.
Pillow.
Pillow. Daughter.
Okay, Kylie, back over there now. Thank you. Okay, so cranial nerve 8 is great. So I don't think we did cranial nerve 7, which is I need to make sure if you can smile for me, frown, and use your eyebrows. Good. Everything's equal and symmetrical, and I don't see any issues there. So we're going to go further, and I'm going to have you open your mouth.
Okay.
I would have a pen light because that would be pretty useful at this time because you can't see anything without it. I'd also have a tongue dispenser, and we would put down her tongue, make sure, oh well, you don't really need one with her, but With the light, hopefully we would see no drainage, no noting of redness. Ask her if she's having any pain or tenderness or any kind of issues, and she's not. So, I'd also note her teeth and make sure that they're good dentition. She's got, wonderful straight teeth. Any problems with chewing, swallowing? Nope. Okay. Tongue, I would also inspect her tongue, make sure, her tongue's intact. You're so goofy. And it looks like everything's fine. Mm-hmm. Okay, great. So then we would go, and I'd go ahead. This would be helpful also if we were in a hospital bed or in an office where I would have like some kind of support for your back, but we don't have that. So, but I would feel for all of her lymph nodes, checking also behind her ear, lots and lots of lymph nodes. Palpating, see anything, nothing right now I can feel is enlarged. She's doing good. No septal defect. Her trachea is aligned. I'd also inspect the back of her neck. Everything color-wise, don't see anything. I palpate her carotid arteries on both sides. I don't feel any deformities or any kind of issues there. So now I'm going to listen to her carotid.
Oh, the sky.
Both sound wonderful.
Good deal.
Okay, and I'm also going to be checking her range of motion of her neck and also her other cranial nerves. So if you could shrug your shoulders for me and push against my hand. Push against this hand. Strong and equal. Great. Okay, so now I'm going to have you lay back down. Actually, well, sit back up.
Okay. So we're
Because I would... Right now, that if she has like an appropriate attire, but we do have a man in the room. So I would take off her, push her gown over so I can inspect her back and look at it. But I would notice any kind of spinal defect. Her spine feels aligned and good. I would notice if she had any scrapes, bruises, cuts, lesions, abnormal moles, skin, etc. Palpate. Make sure I don't feel anything extra nodule-wise or, and then I would listen and have her take big deep breaths. Yeah, you can exhale.
Okay.
Each time.
16, 17, 18, 19, 28, 9.
Okay. You want to make sure you do all lung feels. Then I would come up front and you can lay down.
8, 9, 10,
And
11,
I would also
13,
feel her upper chest area for any thrills or pulses that shouldn't be there. Sorry. And then I would make sure I listen to all of her heart sounds.
7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20.
She has a heart. It's there. Okay, so then going to the abdomen and make sure, and ask her about habits, make sure, she's having everything going on good there. Are you eating good?
Yes.
Okay. No trouble urinating? Nope. Bowel habit? Okay.
It's all good.
Okay, good. First I would auscultate her 4 quadrants. This I'm just doing to listen to make sure your gut's moving. Kylie, get down. On the bed. Okay, you can stay there. Of course, she would have more privacy than a 3-year-old baby if this was a real physical assessment. Bowel sounds in all quadrants is good. She's 36 weeks pregnant, so I'm going to be easy and gentle. But typically you would percuss, and then you would palpate to make sure you didn't feel an abnormal liver or any kind of abnormal nodule. Kylie, oh yeah. So, and also inspect her stomach, and again I'm going to, because this is a video, inspect her stomach, make sure again there's no abnormal skin, her color's normal, no lesions or cuts or anything of concern. No ma'am. Okay, so, and try not to be distracted, Diane. Down, please. Thank you.
Oh.
Kylie, I said no ma'am. Are you gonna get in trouble on video in front of my instructor?
Stay up there.
Okay, right there. You can't move though. Okay, so abdomen looks good. All right, I'm gonna have you sit up.
Okay.
Okay, I would want to check your extremities, make sure that you have cat refill in all fingers and toes. If toes are exposed, I would also want to make sure I check her radial pulses, make sure they're equal and bounding, and check her brachial, and also her pedal.
Okay, kitty.
She's okay. And pulse is all good, equal.
Right.
And let's see, I make sure she has range of motion of all of her extremities, arms. She did good with her neck earlier. Feet will tell in just a second once she gets up all the way. Pat your legs. She's good with rapid movement. Move the coloring book out of the way. Okay, and then I'll have you stand up. Okay. Okay, if you can walk heel to toe for me. Okay. Make sure she's straight and aligned. Okay, that's good. And make sure that you do a small squat. Thank you, shallow squat. And then she normally can touch her toes a lot better, but again, she's got a magical baby that is not 36 weeks inside her stomach. Because she's so small!
I promise.
And I feel like I'm missing something big. But anyways, those are the general things to look for. Again, I would clean up my equipment, make sure everything is appropriate. And yeah, this is my daughter, by the way.
My mommy gave me this.
Hey, tell my teacher to give me a good grade. Hey, give my mommy a good grade, please.
Ryan.
No, not Uncle Ryan. Okay. Well, thank you, and sorry about all the distractions while you're grading. The end.